The Community Scorecard is a social accountability tool that is used to empower service users and service providers to deliver quality services. So it is usually a platform where service users are able to hold their duty bearers accountable over the commitments they are made towards service delivery. Our current data collection in the Community Scorecard has generally been hectic. We tend to use manila papers to collect all this data. Basically, everything is done manually. There are challenges with data collection, challenges with data visualization, challenges with reporting. So basically, the way it is, it's so hectic. So you find that the time it takes to produce a single quarterly report that would have come up in a week, it will take us a period of like 3 months to have it all, the data put together, analyzed, and then reported, and have the final report disseminated.
I'm Amanda McCulloch, and I'm the data visualization lead for Excella. So Excella got involved in this project because I have a long history of working in global health and development. I spent more than 8 years working in that space before joining Excella. And we have the right capabilities and knowledge to work with different and disparate data sets, blending and joining them together, and developing and delivering dashboards in tools like Tableau. We agreed to do this piece of work as a public-private partnership, demonstrating Excella's willingness to engage with and support these kind of initiatives that have a really meaningful impact by doing things like supporting how to do better data-driven advocacy in countries like Uganda and other places around the world where these advocacy initiatives are underway. So Excella takes a user-centered design approach to how we build dashboards and other data visualization products. In order to inform how we would actually build the dashboard itself, we started with collecting insights from local users who would actually be engaged with and using the dashboard, either adding data to the dashboard themselves or interacting with it to surface insights and ideas around how advocacy has had an impact. To kick off that discovery process, we worked with a local consultant who knows the Community Scorecard very well through his role as with one of the organizations who actually conducts the scorecard. And he gathered a lot of insights through key informant interviews and focus groups that then gave us information that we could start to map out different wireframes and different mock-ups of what the dashboard could look like. We tested those mock-ups and wireframes with different local users and with some of our CDC colleagues who will also be users of the dashboard to get feedback and see which charts and graphs suited different kinds of questions. Only once we'd actually validated our different mock-ups did we actually start to actually plug data into Tableau and build out an interactive dashboard MVP, or minimum viable product. And building out that MVP was the kickoff for how we would go ahead and do some user testing in Uganda as part of this workshop. During the workshop, end users interacted with the prototype using a tool called Tableau Reader, went ahead and prioritized changes and identified what we could do to ensure that the final product was the most usable for them. The prototype we interacted with during the workshop included the ability to analyze trends in the different scorecard indicators and really view the advocacy impact, both at individual health centers as well as across health centers. This creates a tool where, for organizations conducting the scorecard at multiple facilities, they can identify where different facilities can learn from each other, where there have been advocacy actions with real impact. So for example, if one health facility sees that they had a low score on, let's take accessibility of HIV counseling and testing, and we see on the dashboard that they improve that score over time, if another health facility is having a similar issue and a similar low score on the same measure, so again, HIV counseling and testing accessibility, they can actually look on the dashboard to identify what specific advocacy action that health center took in order to make that service more available. During the workshop, we even had the opportunity to blend in additional data collected by the CSOs, showing how flexible and nimble the dashboard could be for triangulating new data sources.
It was so amazing to have us all come together as the key populations organizations working on key populations programming, and then being given an opportunity to contribute towards the development of the dashboard. I mean, it was indeed much better having us contribute our views and having Amanda listen to us, accept our views, and have them incorporated.
So our team worked to then take the feedback from the workshop and these different priorities, iterate on the dashboard design, and create additional documentation to ensure that whenever this tool gets handed over to the local CSOs, that they have the resources and knowledge and the toolkit that they can adapt it and use it with their own scorecard data. Excella also worked with the Tableau Foundation and TechSoup, a vendor for global software donation programs, to ensure that the local organizations could gain access to Tableau creator licenses, which will enable them to actually adapt that dashboard to their own purposes.
It has been so amazing to have this dashboard created for us, because since 2015 we've been struggling with data visualization and reporting. Engaging the government leadership with our findings from the Community Scorecards was so challenging, because our reports were so huge, we didn't know how to compress them and have it very small. But now with the dashboards that we've worked on, we are going to be able to come up with simplified reports, very small reports that you can just present to a duty bearer or a minister at the Ministry of Health, and he understands all the issues that the Community Scorecard generated and come up with solutions to address the gaps.
While the dashboard pilot was developed in Uganda with specific input from the Ugandan CSOs, it was developed with flexibility in mind so it could be adapted to different scorecards and different scorecard initiatives across other countries. The CDC aims to be able to use this dashboard in other locations doing community-led monitoring to add additional visibility into the advocacy impact of their work. The goal of the public-private partnership that Excella is leading alongside of Cardno and the CDC is to ensure that there are ways that different community organizations can add visibility to the impact of their advocacy actions. Community-led monitoring is critical for providing a forum for getting people from the health system, as well as people who are attending as patients in the health system, to connect and collaborate and talk about different challenges. But adding visibility to how different changes are made over time also creates not just a place where we can go ahead and identify problems, but where we can celebrate the impact of different advocacy actions. Excella is excited to share the final workbook and framework for replication with CDC and our partners at Cardno in the coming weeks. Once CDC has their copy of the workbook and the framework, they'll be using it with other CSOs in different countries to visualize and understand and amplify the impact of community-led monitoring and advocacy activities. In addition, other organizations are welcome to download the workbook from Tableau Public and adapt it for their own purposes if they have a similar need to track trends over time and make comparisons with something similar to a community scorecard.